The following segment is sponsored by Optum Utah. Women's Health Week is coming right up, and it's a national reminder for women and girls to make their health a priority. Karina Fasig is here from Optum Utah to share how we can take charge of our health. Thank you for being here.
Thank you. I'm so glad to be here.
Appreciate you so much. Okay, why is it so important for women and girls to prioritize their health year-round?
Yeah, I think it's so important because it affects such a large population of us, and it affects women at every stage of their life. So we talk about teenagers, we talk about women in the perimenopausal state, the postmenopausal state, women who are trying to conceive, women who are pregnant, and so it's affecting us through every stage of our life, which is so important to talk about all the time.
Sure. Okay, let's start with maternal health. What are some of the biggest concerns right now in the U.S.?
Yeah, so maternal health is actually a topic that is becoming more of a topic of conversation for global health initiatives around the world.
Yeah.
Mostly because when we think about maternal deaths, we think that it's a pretty rare situation, but it's actually something that continues to happen every single day. And so we actually have a Maternal Health Awareness Day that's annually recognized in January. And the purpose is to bring awareness and provide advocacy for better health outcomes for women who are pregnant in both childbirth as well as postpartum stages.
Sure. Okay. And the CDC highlights disparities among certain racial and ethnic groups. What can be done to help address that?
I mean, I think number one is education. Education is power, is what I like to say. And so I think a lot of people are stunned at how different ethnic groups and socioeconomic factors take play into postpartum health. And, we think about childbirth related deaths, we think about women who die during childbirth, but it's actually related to postpartum as well. So things like domestic violence, things like postpartum depression, those are all conversations that are so important.
Sure, crucial topics. And menopause can be a huge life transition for so many women. What are some of the most common symptoms?
Yeah, so menopause is defined as when women stop having a menstrual cycle for at least 12 months due to a drop in hormones. And this fluctuation in hormones can cause several symptoms, most commonly changes in menstrual cycles, mood swings, vaginal dryness, low libido, changes in hair and skin, and I could go on and on about symptoms related to menopause.
Sure, things to pay attention to. Okay, what are some of the ways to manage these symptoms, both naturally and with medical help?
Yeah, so definitely if you have any of these symptoms, you should talk to your primary care provider about these because we have a lot of medicinal as well as natural options for treatment, and there's so much research that's going into this now, so that's definitely something to have a good conversation with your primary care provider about.
That's great that we have options too,
Yep.
Either way. Okay, let's talk about screenings. What are some of the essential screenings women should stay on top of? These are good reminders.
Yes, so many. So as a primary care provider, we want women to come in for their well women exams at least once a year because we do several screenings. So number one, blood pressure screening. Number two, cholesterol screening, diabetes screening. And then we talk about all of our cancer screenings, so things like pap smears. When are they eligible for pap smears? Mammograms, colonoscopies. We talk about smoking history. We talk about family history. So those well women exams are such a comprehensive, full head-to-toe exam that's so important to have that conversation.
Good reminders, and if you need more information, everything is at the bottom of your screen. Doctor, great to see you. Thanks so much for being here. We appreciate you.
Thank you. Glad to be here. Thank you.